The next disorder that we're going to talk about is schizophrenia. And one of the things that I want to explain is that schizophrenia is now on a spectrum, much like the autism spectrum, where there are varying degrees um, of symptoms and how likely someone is to function normally. Same thing goes with schizophrenia, because not all people who suffer from schizophrenia are going to have the same symptoms and the same degree of symptoms. So that's why we need to be careful when we're talking about these, because not every single person who is suffering from these disorders is going to have the same exact symptoms, okay? Okay, so schizophrenia as a whole, however, is classified by this idea of psychosis. Psychosis is a symptom of schizophrenia. It's not the actual illness itself. But what it is it's where thoughts and emotions are so impaired. Okay, so someone's thoughts and their emotions are so impaired that it's almost as if they have lost contact with external reality. So schizophrenia is characterized by this loss of reality, okay? Um, and if depression is the common cold where like everyone kind of gets it, psychological disorders, um, I'm sorry, that totally came out wrong. But if depression is a common cold of psychological disorders where everyone kind of gets it and it's pretty common, schizophrenia is the cancer, where it is also very common but much more severe than depression, okay? Nearly 1 in 100 people suffer from schizophrenia, and throughout the world, 24 million people suffer from this disease. And that was in 2002, so it could be more now. We know that schizophrenia starts manifesting its symptoms in young adults, usually between the ages of 18 to 20. This is when a person kind of has that first psychotic break, and when we first start exhibiting symptoms. Both men and women are affected equally. However, we do tend to see women have less severe symptoms, right? So men are experiencing much more severe symptoms that we're going to talk about in a little while. So here is the prevalence across the world. You'll notice that the US is much lower than some other countries. And it might be because we have the ability to catch the disease, not catch it like, you know, you now have it, but like um, diagnose someone with the disorder early on, and that person can get treatment and potentially have, you know, recover from it. Now, schizophrenia is something that someone, if they're diagnosed with, will have forever. However, you can treat the symptoms of schizophrenia, okay? So, like I said, schizophrenia is a spectrum disorder. So, someone who is on this spectrum disorder is going to suffer from these symptoms and these um, ideas, but in all different capacities. Okay, so there are three things that we see with schizophrenia. The actual word itself literally translates to split mind. And this is the idea that it's a split from reality, okay? Not that our mind, our actual brain is like split, right? Like the split brain disorder or experiments that we've talked about, but like a split from reality. Our brain has split from reality. And we notice those things in disorganized and delusional thinking. We call these delusions. This would be something like we think that someone is watching us from the CIA. Okay? Disturbed perceptions, perceptions without sensations. Remember, we talked about this in sensation and perception way back when. Those are hallucinations, right? We are perceiving something when the sensation isn't actually there. And then finally, inappropriate emotions or actions. So let's talk about each of these on their own. So one of them is disorganized thinking. This is a quote from a person who is suffering from schizophrenia. So this morning when I was at Hillside Hospital, I was making a movie. I was surrounded by movie stars. I'm Mary Poppins. Is this room painted blue to get me upset? My grandmother died 4 weeks after my 18th birthday. you'll notice that this is kind of like bizarre, random thinking, as well as distorted and false beliefs. Those are the delusions. So the idea that I'm Mary Poppins is a delusion, okay? But it's also very disorganized. There's no real logical reason that all of these things are going together. Many psychologists believe that this disorganized thinking comes from a failure in selective attention. So people with schizophrenia don't have the ability to really control that selective attention. Therefore, their mind just kind of like spurts out anything that it's thinking at that moment. Okay, disorganized perceptions. Remember, perceptions without sensations. Those are hallucinations. These can come about in any type of hallucination. So auditory, visual, gustatory, olfactory, like any of those can happen. However, most of the time these hallucinations are going to be auditory. People with schizophrenia are often going to hear voices. Sometimes they'll see things as well, but most of the time it's going to be hearing voices. And then finally, inappropriate emotions and actions. This is where the person is going to respond to a situation in an inappropriate fashion. So if they just hear that someone died, they might laugh instead of like kind of being surprised or crying or sad. They just might laugh. Also, we tend to see people with schizophrenia show flat affect. This is the idea that they show no emotion at all. You can give them the most emotional movie that you've ever seen, like Up, like the first 10 minutes of Up, right? And no emotion at all. Okay, so when we talk about schizophrenia, we're going to talk about positive and negative symptoms. Now, think back to when we talked about correlation. Positive and negative meant adding and subtracting. Or I'm sorry, not correlation, reinforcement. Positive and negative meant adding or subtracting, right? So positive symptoms, we are adding behavior, adding inappropriate behavior to normal functions. Okay, so this is excess of normal functions, distortion of normal functions that tend to be most frequent at the first stages or early episodes of schizophrenia. So again, we are adding inappropriate behavior. And these include delusions. We're adding in those thoughts that aren't real. We are adding in hallucinations. We are adding in distorted speech. Okay, so where you're saying the word salad, right? Where the words are all coming out in a jumbled order. We're adding disorganized behavior where they might be like reading a book, but then they move quickly somewhere else to do something, okay? We talked about each of these a little bit, so I'm going to go through these kind of quickly. Delusions, again, those are the distorted or false beliefs. Usually these are persecution. They think that someone is out to get you, okay? So delusions of persecution are that they think someone is going to get them, or delusions of grandeur are things like I'm Superman, where they think they are something else. Hallucinations, perception without sensation. Usually they're auditory, however, sometimes visual, olfactory, or gustatory. Disorganized speech, word salad, where you're saying different words or different fragments in all different illogical orders. And then disorganized behavior, motor behaviors that are inappropriate. The individual might perform like these compulsive acts, like continually rubbing their arm or like doing this with their hands or like rubbing their hands, right? Or rocking. That's a disorganized behavior as well. Okay, negative symptoms then. Remember, we're subtracting. So this is where we have the absence or the subtraction of normal functions. Okay, so this is behavioral deficits or the loss or decrease of normal functions. These tend to show up later in the diagnosis. And these include that flat affect, right? The subtracting of normal emotion. apathy or non-interest, monotone voice, subtracting those normal emotions, poverty of speech, which is where they're not going to speak, where they go a long time without speaking, or it's very slow. They might say a sentence, or they might be telling you a story, say one sentence, stop for like a minute, and then come back. A lack of directedness, meaning they are very slow in their movements, or they don't want to participate in any social situations. Those are all negative symptoms. Okay, so there are two different types of schizophrenia. Obviously, we know, again, these are on a spectrum, right? Those symptoms are all going to be varied from person to person, but we have chronic and acute schizophrenia. Chronic schizophrenia is slow to develop, meaning that these symptoms show up very slowly over time. Usually, recovery from this is doubtful. And usually these people are going to be displaying those negative symptoms, the flat affect, slowed speech, not wanting to participate in society. Those things are really difficult to treat, and recovery is doubtful. Acute schizophrenia develops really fast, and it usually is like immediate, and they have this like break where they're now hearing voices, okay? Usually these people are showing those positive symptoms, hallucinations, delusions, etc. And recovery is better purely because we have better ways to treat those symptoms, okay? So we have good ways to treat hallucinations and treat delusions, so it's easier for us to treat that. Some common characteristics of schizophrenia. This is in addition to those common positive or negative symptoms: paranoia, constant preoccupation with those delusions or hallucinations. Usually they are completely worried that someone is out to get them, or they're so involved with the idea that they are Superman or they are a superhero that all they can think about is trying to save people. Catatonic is immobility, or excessive purposeless movement, extreme negativism, or parrot-like repeating of another speech or movement. Basically, this would be like where someone would be rocking back and forth. They're repeating a word over and over. That's being catatonic. Okay, so schizophrenia does affect children. This is a chronic mental illness for children, and usually, again, the person loses touch with reality. It's pretty similar to adult schizophrenia, but it occurs really early in life, and it has obviously a profound impact on a child's behavior. This includes hallucinations, delusions, irrational behavior and thinking, and then problems with carrying out their daily tasks. Okay, so let's think about this. Where does it come from? Schizophrenia is a disease of the brain, so something is wrong with the brain, and the symptoms of that are cognitive symptoms, right? Symptoms of the mind, those hallucinations, those delusions. So we know, and this is important, so star this over and over. People with schizophrenia have higher levels of dopamine D4 receptors, meaning that there's an overactivity of dopamine in the brain. Okay, so write that down, star it. Okay, that's important for you to know. They have overactive dopamine activity. They have higher levels of those receptors, so more dopamine can go into those receptor areas. Also, there's abnormal activity in the frontal cortex, the thalamus, and the amygdala. If you think back to Unit 2 and think about what those structures do, it makes sense why there's abnormal activity for someone with schizophrenia if you think about the symptoms. And adolescent schizophrenic patients show brain lesions, meaning that their brain has damaged itself. And then also we have the morphological changes within the brain. Basically, the fluid-filled ventricles. We have these butterfly-shaped structures in our brain that's just kind of like the lack of anything, and they're enlarged in schizophrenic patients.